Hey all, and welcome back. So things are changing around here. That's why we're in this weird makeshift space. We are moving to the 7th floor, Women's Healthcare of Illinois and Family First Medical Group, both moving. Also, and since we're talking about moving, let's talk about moving in terms of coronavirus.
Right.
Lots of things are changing, lots of second wave talk, lots of gatherings happening. So let's talk about the do's and don'ts in terms of how things are now.
Okay. Sounds good.
So one really common question that we get is it okay for children to see other children? And is it okay for adults to socialize?
Sure. Well, as you'll find out, there are caveats to all of these answers. Children can definitely hang out with other children as long as the other children and their families are comfortable with it. We know that kids under 18 are at very low risk of getting really sick with coronavirus. The problem is, do they live with adults that are sick and at high risk? Because if they do, then there's some concern, and then you may not want to get together.
Okay, and what about adults hanging out with other adults? Same thing?
Same thing, yeah. I mean, you kind of have to test the waters. You have to see, what people are comfortable with. If adults are frequently taking care of their elderly parents, or they're in a job where they're working with a lot of elderly sick people, you probably don't want to get together that frequently with those people.
Right. Alternatively, if they're working in an environment where they're taking care of a lot of coronavirus patients, then they probably don't want to see other people.
Right.
Great to gather outside, maybe not in a closed space, but maybe backyard barbecue or hang out on the front lawn rather than get together.
You can be outside. You can hang out. You don't have to wear a mask if you're 6 feet apart. But if you're in an enclosed spot or you're close to other people, that's probably when you want to wear a mask.
Okay, good advice. Next very common question, can I fly? I want to travel. How can I travel? I suppose I could drive. Is that okay too? How do you feel about flying?
Well, this is really just because you want to fly, right? No, again, it's the caveat of, are you going to visit people that are high risk? Are you planning to come back and hang out with elderly people or people that have chronic medical conditions? I've had some patients who have wanted to come and visit their parents, and they've traveled, and if they're flying on a plane and they're exposed to a bunch of other people, one of the precautions that they can take is they could actually get tested when they arrive to the spot that they're going to, or they could isolate themselves for a couple weeks if they have that time to then visit family members. There's a lot more testing available. We have rapid testing here, so we have had some patients that will, they're getting ready to go on a trip and visit other people, and they get tested beforehand so they know that they're not bringing anything into the group.
Yeah, that's a great idea. And obviously, if you have any health risks, you yourself wouldn't want to fly.
Right, definitely. Yeah, if you're 60 or older, but you're healthy, it's still a little bit risky. But definitely, if you have other medical problems, diabetes, lung disease, COPD, any autoimmune disorder, any of those conditions, those are probably not good. It's still not a great time to fly or travel.
And you definitely still want to wear a mask if you travel. It is required to wear a mask while you're on the airplane. I know that in the airports, not everyone is wearing a mask. And of course, I think the best recommendation would be to wear an N95 if possible on the airplane.
If you can, yeah.
Not just a cloth mask that you made on your own.
Right.
All right, great advice.
Okay.
Another not as common question, but in this office we do offer surgeries. Not all of these surgeries maybe are emergent or in need tomorrow. They might even be deemed elective surgeries. We have postponed a lot of elective surgeries, and now patients are starting to have the option to have the surgery. Should they elect to have the surgery? Should they be nervous about going to the hospital?
I actually think at this point we're well prepared now for COVID. We're doing pre-op screening. We're actually doing screening for COVID before colonoscopies, before knee injections, back injections. So there are a lot more precautions. There's equipment that everyone's wearing. We actually, I think, have a pretty good handle on everything that's going on with COVID in the hospital. So I think it actually is very safe now to go and do those surgeries. And all the precautions are taken. And you probably want to do it now because we really don't know what the future is going to hold. We're worried that there might be a spike in cases. And if there's another spike in cases, things may be shifted again in the hospital setting. And if you postpone your surgery 3 months already, then you're looking at maybe 6 months, 9 months down the road.
Yeah. So we ourselves are doing testing. We offer rapid testing for a lot of offices, people having eye surgery, some other common surgeries that you mentioned, or procedures. So that's always an option. And if your office doesn't offer it, you can always come to us and have a rapid test done before a procedure.
Absolutely.
Last question. You mentioned I could see my friends without wearing a mask. What is that crazy talk? How can you go around not wearing a mask?
Well, if you're outside and you're socially distanced, the risk of you getting COVID that way is incredibly low. There was a study that looked at over 7,500 cases of COVID. Only one of those 7,500 cases was actually passed outside. So it's incredibly rare. If you're outside, if you're in a barbecue, you guys are not really close together and you're talking, the risk of getting sick that way is incredibly low, which is why you see a lot of the restaurants and bars with the patios, because that really is a safer way to go out than going inside where you don't know what the ventilation is like. You also don't know if they're adequately cleaning and managing crowds at that point.
So that's, I guess, another good point, that it would be okay to go out and eat if you're feeling comfortable with it, if you're not immunocompromised or don't meet the other criteria of why you shouldn't go out and about. Because if you're able to go to an establishment that offers dining outside, the risk is pretty low.
Exactly.
Yay! All right, well, that's it for this week. Let us know if you have any questions for the future. We are here to answer all of your coronavirus questions and needs.
Yes, and maybe next time we'll have a different view.
Yes, we'll see you next time on the 7th floor. Exciting changes happening here. Women's Healthcare of Illinois and Family First Medical Group moving to the 7th floor.